You pass it to our moderator for today. I have the agenda on the screen so you can follow along. So yes, without further ado, Maziel,
Thank you,
I'll
Sarah.
let you.
Good morning, everyone, and welcome. Thank you for joining Rutgers Cancer Institute and Screen and J as we recognize World Cancer Day and celebrate the 2026 theme, United by Unique. Today is about highlighting the incredible work that reflects unique strengths, challenges, and needs of each community. We're grateful and excited to have partners who bring deep commitment, creativity, and compassion to cancer prevention, care, and support. Before we begin, we want to take a moment to honor Maureen Kuhn from the American Cancer Society, who was originally scheduled to join us today. Maureen dedicated more than 13 years to the ACS, beginning as a patient navigator and eventually serving as Associate Director of Cancer Center Partnerships. She was known for building strong relationships across New Jersey's cancer centers, hospitals, and community organizations, and for her leadership in statewide education and outreach efforts. We are grateful for her contributions and saddened by her recent passing. We hold her family, colleagues, and community in our thoughts today. We invite everyone to join us in a moment of silence in her memory. Thank you. May her great work and legacy live on and continue to touch and bless lives. I'm Maciel Guzman, and I'll be your host for today's panel. I'm one of the Screen NJ Senior Care Coordination Specialists, and I oversee the Northern Patient Navigation Team and work with our Northern partners to improve screening outcomes for underserved communities. I'm excited to introduce our speakers who represent organizations doing powerful community-driven cancer work. First, I'll go over a couple housekeeping notes. Panelists, please remember to mute and unmute yourselves as needed. Attendees, we will have time for questions towards the end, so feel free to type any questions, as you think of them in the chat box, and we'll go over them during the Q&A portion. All right, so we'll get started. Panelists, I'm going to introduce each of you by name, and as you're called, you have 5 minutes to share a little bit about yourself and your organization. So I'll begin with Nuha Kased Hamoude from Bergen's Promise. Nuha, floor is yours.
Yes, hi. My name is Nuha Hamouda. I am the Health Community Outreach Specialist at Bergen's Promise. I'm sorry, okay, I'm gonna share my screen. Give me a second. Okay, sorry. So I'm a certified health educator, as well as a certified youth and adult mental health first aid instructor, and a certified trainer at Assist and Safe Talk, a suicide prevention trainings, and a Nurtured Heart trainer as well. So I work as the health community outreach specialist at Bergen's Promise. Bergen's Promise is the designated care management organization for Bergen County as part of the New Jersey Children's System of Care. We help youth up to age 21 with emotional, behavioral, substance use, developmental, or intellectual disabilities. Bergen's Promise is built around one mission, keeping families.
Oh no, I think you got muted. I don't know.
Okay. Now I'm get back. Now you hear me? Okay. So we do that through the wraparound model of care, which is an individualized, family-driven planning process that focuses on a family's strengths, values, and needs. A key part of wraparound is the child and family team. This is the group of people the family identifies along with providers and community supports working together to create one coordinated plan. For youth who have both behavioral health needs and medical needs, our behavioral health home helps integrate care so families aren't navigating multiple systems alone. Overall, our families or our approach is coordinated, community-based, and centered on what works best for each child and family. Bergen's Promise works to address the mental health needs of youth and families across Bergen County, serving New Jersey legislative districts 35 through 40. In 2025 alone, we provided services to 2,920 youth and families. And since 2002, since we started, we've served more than 12,500 youth in Bergen County. Our outcomes show real impact. 85% of youth have had stable or improved mental health and behavioral health. 95% of families had stable or improved caregiver strengths. 91% of youth improved in life domain functioning, and 97% had stable or decreased risk behaviors. These results reflect how our wraparound approach supports both youth and the whole family. Thank you. So this is about Bergen's Promise.
Okay, thank you, Nuha. Next, we'll hear from Health and Wellness Coach Brenda Green.
Thank you, Nuha. Let me go ahead and share my screen. You guys should be able to see my screen. I got to see you guys. Hi, everyone. My name is Brenda Green. I am a breast cancer survivor and a health and wellness coach. And today on this World Cancer Day, first of all, thank you so much for allowing me to be on this panel. Extremely excited on this World Cancer Day. And with the theme of United by Unique, it really does remind us that there's no single cancer story. Everyone's diagnosis, everyone's treatment, every survivor experience is different. Where I come in is what we often overlook is those differences that happen after treatment. That chapter where, scans slow down, appointment stops, and many of the survivors, including myself during my time, we're left with asking, now what? So I created a program called the Cancer Free Living Program, and it exists in order to help survivors after treatment. Really bridging that gap between treatment and going back into regular life. So here, everyone's treatment is unique. So just to tell you a little bit about myself, this is my beautiful family. I live in Secaucus, New Jersey. I am married for 18 years to my husband, Steve. I have a 14-year-old daughter who goes on 18 almost because she thinks she's grown. Her name is Sanaya, and what's really unique about this amazing picture, and this is a very recent picture, she is also a cancer survivor. She is 3 years in remission from non-Hodgkin's T-cell lymphoma. So she is doing amazing for everyone who asked or is thinking it, as you can see in this picture. So a little bit about me. I really have combined both not only my personal experience as a cancer survivor, but also as a cancer caretaker with my professional expertise. Again, I'm a 10-year cancer survivor. I'm a nationally board certified health and wellness coach, a NASM personal trainer, as well as a personal nutrition master coach. But what really truly shapes the work I've lived is my lived experience. I've rebuilt my strength, my confidence, and my relationship with my body to the point where I stepped on a bikini competition stage after treatment. And that's really where my slogan comes in as declaring cancer I won. So my mission since then has really been to help survivors put the pieces of themselves back together to be stronger and more confident even before their diagnosis. So with my program, who I've partnered with, the Rutgers Cancer Institute, it is a 12-week program, and it's designed to embark breast cancer survivors and some cancer survivors to reduce their risk of reoccurrence and enhance their quality of life through, honestly, evidence-based, sustainable lifestyle changes. And it's really grounded in what I call the 3E formula: embrace, elevate, and embody. And it really helps transition survivors into this confident, sustainable, healthy lifestyle, because that's really important. When we're going through our cancer journey, we feel like we don't have any control over anything, but we really do have control over many things. And that's what this program really helps. In Sarah, at the end of the session, will also share one of my resources, which is a quick quiz, a 3-minute quiz to help identify where you are on your wellness journey after your post-cancer treatment. So Sarah's going to share this. So that's a little bit about me.
Thank you, Brenda. That was awesome.
Thank
So
you.
now I'd like to invite Deacon Francis Dixon from New Hope Baptist Church.
Okay, Deacon Dixon, you have to unmute. So I'm gonna. Okay, yeah, you got
We
it.
good?
Yep.
All right. So I'm sorry about that. Good morning, everyone. And thank you so much, Team Sarah, for the invitation to join you all today. I am a cancer survivor as well. And so this is a great opportunity for me to share what we do at New Hope Now. That is our nonprofit at the New Hope Baptist Church, located at 106 Sussex Avenue in Newark. I've been a member of that church for the last 32 years. I've served currently as the executive director for the last 16 years. And it has been a real pleasure for me to do this because we're working directly with the community. Primarily, the nonprofit was actually started because our senior pastor years ago, the neighborhood had changed, and people started coming to the church looking for donations, looking for clothes, looking for something to eat. So he had the inspiration to start a soup kitchen. And what has morphed over the last 25, 30 years is an expansion of services. We currently are operating our food pantry, food distribution, our lunch. We serve lunch, breakfast, at lunch and breakfast. We have a clothes closet, but we've expanded in a number of other ways as well. We're now offering services to the general community, whether it's to assist guys and girls returning from incarceration, community members who are looking for work. We have a addiction services department that has been probably the hallmark of all of our services, which was actually stunted since COVID. But in the past, we generally would handle anywhere between 15 to 20,000 clients per year with the addiction services as well as with the other services that we offer. I'm just delighted to be here today because these are opportunities for us to find new partners, to talk, as we are doing now, a lot more about what it is that we do. And because of that, I've been able to, with the assistance of a great staff, expand our services even beyond where we were 10 years ago. What do I mean by that? By partnering with local and some state organizations, we've been able to move not away from what we were doing, but to expand into a more deep community service with health services. We've partnered with a number of the hospitals and health organizations in the Essex and Union County areas specifically. We also have thrived with some of the state organizations that have provided a number of assistances to us. One of the areas that I always mention is our partnership with Rutgers, Dr. Diane Hill, who is the Assistant Chancellor of the Newark campus. We've been working together over the last 10, 11 years and have developed a number of different programs from from the area of fitness. We've also done some things with our seniors, veterans assistance, that have caused us to really get involved with the fabric of our community. I'm looking today to share a lot more. I know we're limited in time of overview, but I would look forward to connecting with any of the organizations that are online and viewing this program and share a little bit more with you. Thank you for this opportunity.
And thank you, Francis. That sounds like great work you're doing.
Thank you.
And now we have our final speaker, Iris Novas Cooney from Horizon Blue Cross Blue Shield. Take it away, Iris.
Good morning. So good to be with you, and thank you again for the invitation. I'm Iris Novas Cooney, Community Health Education Manager for the Department of Member Advocacy and Community Outreach for Horizon NJ Health. Horizon NJ Health is a subsidiary of Horizon Blue Cross and Blue Shield of New Jersey, the largest healthcare management company serving publicly insured individuals in the Medicaid and NJ Family Care Program. Since its inception in 1993, Horizon NJ Health has grown to serve more than 800,000 members and provide services in all 21 New Jersey counties. At Horizon Blue Cross and Blue Shield of New Jersey, our mission is to empower our members to achieve their best health, focusing on driving innovation to improve healthcare quality, affordability, and member experience as a leading health insurance in the state. We're dedicated to enrich the lives and health of our New Jersey communities. The Department of Member Advocacy and Community Outreach are boots on the ground individuals providing NJ Family Care Medicaid benefit information and focused health promotion through education to increase health literacy, benefit understanding, and support utilization to help improve health outcomes of our members. Our team provide and bring these resources to the community through partnerships with community-based organizations rendering services to our members. We aim to meet our members where they are within their communities. The advocacy and outreach team are comprised of two sections, the community health team and the health education team. The community health team are Medicaid NJ Family Care subject matter experts. They help explain NJ Family Care benefits, eligibility, and supportive services. They assist enrolling individuals into Medicaid, help identify Horizon members, and connect them to supportive programs like case management, renewal assistance, member services, food resources, and housing support. The health education team are differently disciplined population health professionals specialized in community health education. We develop and provide evidence-based health education presentations, initiatives, and programs through both a public health and social driver of health lens, specifically for vulnerable populations within government programs like Medicaid, dual eligible special need plans, and managed long-term services and support. The initiatives and educational materials are developed from feedback by our members, community participants, community-based organization partners, advisory councils, internal departments working with the population we serve. I have 28 years of professional experience within healthcare as a clinician and public health researcher, serving the last 12 years within community health education at Horizon. I appreciate the opportunity to participate on this panel and today's discussion. I'm going to turn it back to you, Maciel.
Thank you so much, Iris. And thank you all for those thoughtful introductions. So we're going to begin our panel discussion now. And our first question is for Bergen's Promise. How does having the Screen and J grant allow your organization to provide additional services to your communities? What are some challenges and successes or some wins that you can share with us? And this question is for Nuha. Bergen's Promise.
Thank you, Rosal. Thank you. And That's a really great question since I guess everyone would be wondering, like, this is a webinar about, cancer, screening cancer and cancer survivors and how to prevent cancer. And I'm talking about, behavioral health and mental health and youth. Well, this is how we came through. We have been receiving grants from Screen NJ for the past 3 years. This is our third year getting the grant from Screen NJ to do our services. So how we do this. So it has been really meaningful, expanded how our organization supports prevention in the communities we serve. So as I mentioned earlier at Bergen's Promise, we operate through a wraparound model of care. And integrated care is central to our mission because prevention and early identification work best when the whole family has access to resources, education, and support. So the grant has allowed us to do three key things. First, it strengthened our ability to promote Screen NJ screenings constantly, helping to normalize screening, increase awareness, and reduce stigma by meeting people where they are. Second, the second thing, it helped us bring prevention-focused services directly into the community through wellness events, school-based workshops, and community presentations. As I mentioned, I'm a community health specialist, and I do all these different trainings. So I'm all over the community in every event that is in the community, whether community-based, schools. So this helped us to bring these resources into these events. So third, it allowed us to provide practical resources for the entire family. I know we do services for kids or for youth up to age 21, but we also have families and integrated care, and the wraparound is really important. So we want also resources for the whole family. So we're getting resources not only to the identified youth that we're serving, but also for the whole family. So caregivers and siblings also receive education, tools, and connection to supportive services. So this is how it helped. Now, what was the other question? What was some challenges and some wins, right?
Some wins, yes. Yep.
Okay, so in terms of wins, we've seen increased engagement and greater openness to screening conversations, especially when screenings are paired with education and clear next steps. They want next steps. What are available? So we've also built stronger partnerships with schools, local agencies, and community leaders, which has improved outreach and trust. So that was like a very big win. Now with challenges, maybe I would say the common challenge in outreach and health education is misinformation. So we often see misconceptions about topics like HPV vaccinations and vaping. So for HPV, some parents worry the vaccine encourages sex. So we have to spend extra time reteaching that it's about cancer prevention and long-term health. With vaping, teens and sometimes parents assume it's safer than cigarettes or better than drugs. So we use those moments to clarify the real risks and provide reliable evidence-based information. So overall, the Screen NJ grant has helped us move prevention from being a concept to being something families can experience through awareness, screenings, and concrete resources that support healthier outcomes.
Thank you,
Thank
Nova.
you.
Thank you.
So thank you so much for this opportunity for the past 3 years. We really appreciate that. Thank you.
Thank you. I love how your services are focused, encompass the whole family. That's so important in our communities. Thank you. All right, so we'll move on to Brenda. So the next question is for Brenda, our health and wellness coach. Can you highlight one program, service, or initiative from your organization that you're especially proud of and tell us about the impact it has had?
Good morning again. So I sort of kind of mentioned it in my intro. So I created the Cancer Free Living Program, which was created to address what happens after cancer treatment ends. Many survivors are told that they are cancer-free, but are honestly left without guidance on how to rebuild their health, their energy, their confidence moving forward. So this program really exists to support survivors that often overlook that phase of survivorship. So the Cancer Free Living Program, it is a pilot program that we just launched. We are only 2 weeks in of the program. It's a 12-week program, and it's evidence-based and informed wellness and behavioral change program designed to specifically for cancer survivor. It really takes into account the whole person, including their physical health, their emotional well-being, their lifestyle habits, and long-term lifestyle. The focus is on practical, realistic strategies that support quality of life and overall health. Again, we're only 2 weeks in, so as far as impact in the question, we are getting there. So far, we have a lot of engagement from our participants. They're excited about the program. They're stating that this is something that they wanted, because once you go through your cancer journey, everything ends. All the support that you have during your cancer journey kind of ends when you're done. Your doctors, you no longer have to go back to the doctors. You don't have as many appointments. Your family goes back to their regular life. You start cooking for yourself and doing everything for yourself. If you're a mother, you have to start taking care of your child again. And all of those things, you just kind of go back to normal. And the world expects you to go back to normal. But unfortunately, we as survivors don't feel that way. So what's that transition look like? And this program really allows for that transition, and also how to improve your lifestyle. In the program, we teach about integrating movement, nutrition, mindset, stress management. So talking about the entire person and the process throughout the program. The program is delivered in 3 phases, which is 4 weeks each phase. And it continues. The first phase is called Embrace, where it focuses on reconnecting with really the body, who you are, who you were before your cancer diagnosis, who you are now after your cancer diagnosis, and identifying what's that new identity that you have. And also embracing all the emotional impact of having cancer. During the journey, you don't have time to really think what's going on because you're just in survival mode. It's usually afterwards, and there's studies that after cancer, most people become depressed and don't know what to do. And this program allows you to go through that process emotionally, because in essence, it is a trauma that you just went through. The second phase is Elevate, where it really centers on building sustainable habits around movement, nutrition, and energy. And the last phase is called Embody, where it supports the survivor in living with confidence, intention, and consistency beyond treatment. So they're learning strategies, actual strategies and tools that they could use going forward, even after the program. At its core, the Cancer Free Living Program just helps survivors move from surviving to really living and thriving. And it's providing education, structure, as well as community, because it is run as a cohort in a group. So they're not left navigating life after cancer on their own.
Thank you, Brenda. That sounds awesome and so needed.
Thank you.
Thank you. So next, I'd like to ask a question to Deacon Dixon. What makes faith-based organizations like New Hope Baptist Church and partnerships between healthcare organizations effective? Is there anything you wish healthcare organizations knew before engaging with this community? You're muted. There you go.
That's a 2-part question, I assume.
Yes, you can take them one at a time.
I'd like to go back to, in answering that question, is to go back to the relationship that we've developed with Rutgers and several other community partners, with Rutgers being the lead in introducing us. It took New Hope Now out of our traditional addiction services, food service, employment area, and has taken us over the last several years into areas that I really didn't expect, but was great and willing to go. And I'm talking about programs that we were involved in that was statewide, called the HEROES program, which was enacted during the COVID period of time. And we were able to, as an agency, take part in information gathering, surveys. We provided testing kits to the community. We provided a lot of awareness information to the community. And that is just one particular initiative. The current initiative that we're partaking in is called the IFAM initiative. And with that particular initiative, we are doing focus groups. We're working with leaders in the and other healthcare-ish areas to provide community information, doing workshops, as I mentioned, focus groups. And these type of initiatives are leading us to other things. We've been, when I say we, a number of my staff and staffs on other partners that are with us have been trained to be community scientists. Now, the beauty of this training and having completed it successfully allows us now to have introductions and input to healthcare organizations with information that we have gained through the training to show that there is some more value to what we can do in helping the various healthcare organizations continue whatever their particular goals and strategies are. So that has been one of the things that has been a real big highlight. And again, I mentioned Dr. Hill specifically because it was her brainchild to organize the community partnerships. And with that, as I mentioned, we've been able to get involved with areas that I did not expect to, but I'm so glad that we had the opportunity to do that, because now we're actually looking at the issue of cancer, and that's what brings us in to today's area of conversation, and that is for us to be introduced to and or just reach out directly to organizations such as your own, and those that are probably listening in, to see where we can fit in, feeling that we do have some expertise, and as well as information gathering, sharing the information with the community, and being able to connect the dots, so to say. Now, what was your part two question?
So is there anything you wish that healthcare organizations knew before engaging with the faith-based community?
Yes. And I would stress again the fact that many of us have engaged in getting more information, up in our game, so to say, in terms of how we can be a benefit to them. Over the years, I've hosted a number of health organizations meetings and fairs and luncheons and things like that. But those at that time, those events were somewhat limited by means of the organization coming in and just sharing information that was important to them, without coming in and saying, "Well, what can we do for you all? What is this particular neighborhood in need of? What are some of the cultural and behavioral things about this particular neighborhood that we might be missing?" So those, right off the top of my head, would be something that I would love to see. And I think it's happening. As a matter of fact, I'm sure it's happening with some of the healthcare organizations. As a matter of fact, there is a partner that I've worked with from Horizon on this panel, and have had great success in hosting events with them. But the key thing for me again is for the healthcare organizations to truly look at the value that we, the community partners, have at this point in time. Thank you.
Thank you for sharing, Deacon. That perspective is incredibly valuable. My next question is for Iris. What kind of evolution have you seen in the insurance industry when it comes to supporting community members affected by cancer?
Thank you for the question. To the point of our panelists, partners, I think we've focused from a payer's perspective, we've really focused on increasing the health literacy, not only of the larger community that we serve, but our community partners that we work alongside with to increase their health literacy understanding of different conditions. In addition to understanding, much to like what Deacon Dixon mentioned, understanding the specific need of that particular neighborhood, population, or sector. So again, is as intentional as we are bringing in the information, we want to ensure that we are integrating it to meet the needs of that specific community, ensuring that we are actively listening, not only to those that we are rendering the services to, but agencies providing direct services to that specific population. So we aim to work collaboratively to not only meet those needs, but be very intentional as far as listening and adapting to the evolving needs of the community. New Jersey's a very diverse state, and the needs vary from sector to sector. Even if they're neighboring counties, they're not exactly the same. So again, we aim to not only increase the healthcare coverage understanding, like benefits information, but also focus health promotion through education to increase literacy, benefit understanding, supportive services to directly impact the health outcomes through shared and informed decision making through a lens of culturally appropriate and trauma-informed way. So again, this is intentionally working alongside in a cross-disciplinary way around the same focus around health promotion and supportive services once there is a diagnosis and folks are moving through dealing with conditions, including cancer treatment.
Thank you, Iris. Thank you for your insight. Okay, so this brings me to our question for all the panelists. While each of your organizations is unique, World Cancer Day reminds us that the progress happens through collaboration. How do partnerships and collective efforts strengthen cancer prevention and care? And what does United by Unique mean to you in your work?
Okay. Well, I'll jump in.
Mm-hmm.
Am I muted?
No, we can hear you.
Excellent. And I think this is a lead into what I've been talking about, just in terms of partnerships and the strength of partnerships, and partnerships that are considered equal to one another, gives insight. Let me put it plainly. There are things that I can gather from the community that maybe the larger organizations cannot. There's still a fear in our Black and Brown community of organizations coming in to just gather information. So there again has been one of the strengths that we've had, where we were able to cut across the field, so to say, and get the kind of information that these organizations need, whether they're pharmaceutical, healthcare organization, whatever they might be. I think the strength of the partnership that we have with them will allow the opportunity for more and better services to be offered to our community. And I'd like to say that Ms. Kooning was one of the partners that I had done a few things with. And I must say, the outcomes from those workshops and events that we did together were excellent. I believe that her organization is one of those that highlights the value of partnerships.
Can also jump in.
Yeah, if I could jump in, thank you, Deegan Dixon. It's an honor and a privilege to partner with you. But again, we aim to partner across multidisciplinary approach, right? So including faith-based, school-based, community-based, seniors. Again, wherever our members are, that's where we aim to be, and we can't do that without the trusted stakeholders working alongside them in order to work together, not only to increase the information gathering and collaborative approach, but also working together so that we help identify and refer to each other when possible, right? So again, the focus is to increase health literacy and improving health outcomes, not only to improve the outcomes of that specific neighborhood, but also to encourage informed decision making around individuals' health, right? And then have that behavior of wellness echo across the community, right? So we're all modeling that same level of health literacy and information sharing around health promotion in an active way. So again, we wouldn't be able to do this without the trust and open collaboration of community entities in a cross-disciplinary approach, right? So from faith-based to hospital systems to federally qualified health centers to food pantries, school-based, again, from the state level all the way down to the municipal level. We are open and willing to work with anyone and everyone who is willing to work collaboratively with us to share the information, learn about them, learn about us, and then work together to increase health promotion throughout our state.
Thank you.
Yeah, I can also talk from our point of view. So partnerships really strengthens, of course, cancer prevention and care. And because no single organization can meet every need across the full continuum. So education, screening, navigation, treatment support, and survivorship. Collaboration lets us align messages or messaging. It reduces duplication, it closes gaps, and creates clearer pathways for families. It also increases trust and reach, as Iris mentioned with the trust. People are more likely to engage in prevention and screening when information comes through multiple familiar, coordinated community partners. So people may be able, may take that from their faith leader, or no, I'm not a faith person, I'm going to take it from my organization. So each one will, so if we all partner, you don't know which one will actually take the message from who. So in our work at Bergen's Promise, partnerships are really essential to making prevention practical. So when we collaborate with school, we collaborate across with schools, local health system, community-based organizations, and municipal leaders. We can meet families where they are through workshops, wellness events, and referrals to screening and resources. And so places and resources like ScreenNJ ensures that supports are in place If someone especially needs follow-up, like sometimes they don't want that just the information, they want the continue and they want the follow-up. So they see that and they're taking it from the organizations that they trust and they work with. So collective efforts also helps address barriers that often prevent people from getting screened, like transportations, language, stigma, and limited awareness of eligibility or next steps. So when I did a lot of my, outreach, they did not know that, okay, Screen NJ also provides transportation. Oh, we can get you where they are. We can get you where you are. So these were like a lot of information that they did not know is just, okay, this is screening. So, but how can I get these screenings? So it's really important to get the message across from different organizations. So to me, United by Unique means we are unified around the same goal, healthier communities, while honoring that each family and each community has different needs, culture, and experiences. It also reflects that every partner brings a unique strength. When we stay united, sharing information, coordinating referrals, and reinforcing consistent, culturally responsive prevention or preventive messages, those unique strengths add up to stronger prevention and better care for the people we serve. Different population, different community, so we are able to bring different information to them from across different organizations.
Thank you, Nuha. Definitely hearing the common theme that, collaboration is not just an add-on service, it's essential. And it really speaks to today's mission. Thank you for that. Okay. So we will now take some questions from the chat box, or if people want to unmute themselves and ask their questions, they can feel free to do so. Sarah, were there any questions on?
We have a question for Brenda. Brenda, someone in our chat wants to know if you have Spanish-speaking staff.
Oh, okay. Before I answer that question, I do want to answer the previous question. I mean, Nuha, you summarized that so well and really hit a lot of points. I just want to say that the cancer-free living program that I was discussing would not exist right now without the partnership with Rutgers Cancer Institute. Our shared understanding that survivors need support behind treatment, it really brought this collaboration together. And we're not only really addressing gaps in the post-treatment care, but we're also thinking ahead how this program like this could expand across the state of New Jersey and what partners we need to bring in to collaborate and bring it out. We are in the pilot program, but we are already thinking ahead. So thank you so much for that question. I just wanted to make sure everyone knew this program is out here because of a partnership and collaboration that we do have. As far as the question, Spanish speaking staff, not at the moment, but as I just mentioned, I have a very small staff. I am the coach and I'm running everything. And then we have two or three other people who are support staff. But when I created this program, one of the big things that I thought, I am from the Dominican Republic and speak fluent Spanish. So, and I have two aunts who are also breast cancer survivors. So as I created this program, it was essential for me to know that I want this program to be in the Spanish community. So we are in the pilot program right now, but the vision is that it gets translated in Spanish, and then we get certified health and wellness coaches in order to scale and expand to be able to provide this service in the future in Spanish as well as in English. So we are thinking ahead, and the goal and the vision is that we will have this program in Spanish. Unfortunately, not at the time, not at this time.
Thank you. I thought I heard it, Brenda. I'm Dominican too.
Me too.
Hey.
Hey.
anybody in the chat wants to unmute to ask a question, please do. And also, if you would like to share your contact information in the chat, feel free. Drop your email, your number that people can reach you. This is a great place to network and set up those collaborations. I do have a question for Deacon Dixon. Are you there? Yeah, you're there, right? Okay, yeah. What resources that you currently don't have, but what are some resources that you don't have, but would make your current work easier,
Resources that I don't have,
but would make,
that would make the work easier.
yeah.
Let's start with the big one. Grant, loans, finances.
Money.
That we've managed, and quite honestly, we've managed to do, I believe, and we've been congratulated on many fronts for doing quite a bit with the limited resources that we have. And that's because, again, because of partnerships, and because of the fact that I believe we do a sincere job at working with the community, and that brings other resources in. It doesn't always have to be financial, but it brings in other agencies that, hey, you guys are doing this, we do a little of that. Let us come in and partner with you. So I would say that it's hard for me to say what else would I like to see. But the grants and the money would always help.
Mhm. Thank you. Any other questions, Sarah, that you see on the chat, or anybody want to unmute themselves?
Okay, there's a question for Brenda. Looking back, what do you wish someone had told you about the things you can actually control after cancer, especially related to energy, confidence, and reducing risk?
Could you repeat that again?
Yes, it's
Brenda,
for,
you're on mute.
Oh, I just realized I was on mute.
okay, I'm going to repeat the question anyway. Okay,
Yeah.
looking back, what do you wish someone had told you about the things you can actually control after cancer, especially related to energy, confidence, and reducing risk?
The one thing that I wish someone mentioned was how difficult the transition, honestly, after cancer. Just understanding you're no longer the same person and being expected to be that same person it was a difficult transition. What I ended up doing was I wish I knew more about how could I reduce my risk or even prevent. Um, but now, once I went through my journey, I did the research, teaching that now. And that became kind of like the catalyst, like, okay, I don't want this to happen to me again, but I also don't want this to happen to anyone else again. And how could I make that transition? So really learning the controllables. What could I control? I could control how I think. I can control how I move. I could control what I eat. I cannot control how old I am, my gender, my history, my family history. Those are things I have absolutely no control of. Anything could happen. I was diagnosed at 35 and I didn't know I had a family history. And I honestly,
I think she froze.
oh,
Brenda
did I? Can you hear
froze
me?
for a little bit. Yes, we can hear
Okay.
you now.
So understanding that, oh yeah, I see my connection is unstable. Understanding that there are things that we do have control over to prevent and to reduce the risk. And that's through those measures. And I wish somebody told me that.
Thank you.
Thank you, Brenda, for answering that. We do have a few minutes left, and we probably can take one more question after this, but I just do want to plug in that Rutgers Cancer Institute / Screen NJ is doing two Echo series for this year. We're doing a screening and prevention series and a survivorship series. So I will be dropping the flyers and the links for that in the chat. This is a great place to learn more. It's open to healthcare professionals, people from different cancer centers. It's nationwide. So yeah, hopefully some of you will be able to join us for that.
Yeah. Can I answer, provide another answer to that last question?
Of course.
If you don't mind, and Sister Green, you helped me with your response. As a Black man with no family history, no relatives, no one in my circle, so to say, males, there was no cancer. There was no discussion of it. That seemed to be someone else's, some other community's issue. But what struck me after the diagnosis was given, it just threw my whole thinking off. And then the treatment and coming through 10 years, been in remission. I understand the importance for me as a Black man to make sure that I tell that story, especially around other Black men who might have the thought that I did, that it would never be me. And so that is one of the things that I continue to, any groups that I do several men's groups, and always talking to guys. But that's one of the questions I ask them indirectly: how's your health? And have you had any checkups lately? And do you know what your possibilities of contracting cancer might be? I throw it out there to get a response, and at least to put it on their mind, on their heart, or wherever it might be, to cause them to think about it. Primarily because it's Black men among the highest group of individuals that don't get checkups on a regular basis. They assume that an ache or a pain will go away. And so I try to encourage, sometimes it won't go away, and they need the checkups. So I just wanted to add that.
Thank you so much for that. We're right at time. So as we close, we hope that everybody's been able to gain a lot of valuable information about the different organizations and their efforts. So we want to thank all those that participated. I'm sorry. Go ahead. Marjorie, did you have a question? Maybe it's just someone that's not unmuted. But I was saying we want to thank our panelists, our attendees, and our partners. Your commitment to education, access, and compassion drives meaningful change. Together, through these partnerships and our shared purposes, we're not only improving the cancer outcomes in our communities, we're also strengthening those members of our community. Thanks again, everyone, and please stay tuned for an email with the slides, resources, and a survey. You can also use the survey link on the chat box to complete the survey, and have a great rest of your day, and everyone keep doing the great work that you're doing. Thank you.
Thank you,
bless you all.
Marcel.
Thank
Thank
you.
you, everyone,
Thank
for
you.
joining us.
Thank you, everyone.
Thank you.
Bye-bye.
Thank you
Thank
so
you.
much.
Thank you.